Afghanistan's banks may have shut their doors in expectation of better times, but that's not an option for this village clinic, even if its staff haven't seen a paycheck in nearly 6 months. Difficult pregnancies, malnutrition, polio and COVID. The doctors here have seen it all. The problem is, they soon won't be able to afford the petrol they need to get to the job they're doing for free.
These two girls were injured by bomb blast 3 months before. They gave this things for the fractures of the bones, and they are coming every 3 days for the dressings.
An improvised landmine, intended by the Taliban for government forces, changed these girls' lives forever. Their father says they were lucky. A boy they were playing with died in the same blast. Another girl lost both legs. Their treatment requires care and patience, but the antiseptics needed are inexpensive, just about affordable for their parents, even if the clinic's supplies finally run out. Many other conditions require medicines way beyond the pocket of ordinary people living in these villages. Prescription drugs used to be provided free of charge by the same international NGO that paid the doctors' wages. The NGO pulled out when the fighting between Taliban and government forces escalated earlier in the summer. The pharmacist says it's just a matter of days rather than weeks until his shelves are completely empty. Not all the conditions seen here require drugs. Often the solution is as simple as a nutritious diet.
Since the fighting started, we're seeing more malnutrition. Up to 30% of the babies we see are malnourished, and it's going to get even worse in the winter.
This mother tells us it's all still a shock to her. Her experience with her first baby was very different.
We don't have anything, not even flour. My husband is a day laborer. He goes weeks without finding a job now. It's such a change. He used to have more offers of work than he could accept.
For the clinic's boss, squaring the circle of spiralling demand and non-existent resources is becoming untenable for the patients and his colleagues.
Our staff are in an impossible position. They can't put food on the table, and they can't even leave home without seeing people they owe money and now can't pay back. They can't even afford to get to work.
He's been to Kandahar and even to Kabul to see the new Taliban officials in charge of health, he tells us. Their answer is always the same. This isn't just your problem, they say. This is Afghanistan's problem, as if that made it any easier to bear.